Hey everybody, welcome to Meddkit's Provider Spotlight, where every week we are meeting the most amazing private practices from all over the United States. We are interviewing really incredible people that are doing great things in their community, and we are here to shed a light on them. And this week we have a really awesome and special guest for you. I want to introduce you to Dr. Blake Galler. He is the owner of Capstone Dermatology in very far Alaska. But welcome, Dr. Blake. Nice to meet you.
Thank you, Rachel. I'm happy to be here.
Yeah, us too. I know we have a lot to dive into, but I would, kind of the way I love to start this off is just, I would love if you could just share your story with us. What inspired you to get into dermatology and what inspired you to open up your practice in Alaska?
I always loved medicine, so I matriculated as soon as you could, right? I think I was like 22 when I got into medical school, and I went to a DO school, so we're
Interesting.
focused on primary care, and I just kind of fell in love with skin after doing a lot of other rotations. People's sense of self really is based in their appearance a lot of the time, and when you think something's wrong, it's immediately apparent.
Yeah.
From a professional standpoint, it's really great to know that not only can you do medicine, but you can also do surgery. And you can even dive into cosmetics, complicated or advanced medical dermatology. You
Mhm.
can still do inpatient, and you can consult, right? Like you can work in these integrated teams and you add something important. And I think we do that here. We add something really important to the communities in both Anchorage and Wasilla and really the whole state because there aren't a lot of dermatologists and there aren't a lot of dermatologists that have good inpatient experience either. And when I
Yeah.
was in the military, we had 8 years of inpatient. So did
Mm.
our inpatient at Brooke Army and Fort Gordon, Eisenhower Hospital, and Parkland. We do an extensive inpatient route there. So I love the field. I love the field. I've never felt limited. I've always felt like if I want to do more surgery, I can. If I want to see more patients, I can. If I want to take more phone calls from the ER, I can.
That's awesome. I love to hear it. And yeah, it must be interesting, practicing, out in Alaska. I'm sure, we'll gather some stories a little bit later on, but I'm sure opening your practice here has been pretty eye-opening and throughout your experience, being in the military, being a DO and being a dermatologist, I'm sure has its differences and how your approach to medicine is very different. And we look forward to hearing about that. But something that I'd love to learn from you is, some of the common areas that you're treating and finding people struggling with today. Like kind of what do you see coming in the office? What are the common struggles? But then I feel like there are a large section of things that dermatologists do, or maybe uncommon things that you treat and that you do that people really don't know about, that people wouldn't say, oh yeah, I'm gonna come see Dr. Blake about this, this is something that I know he could treat. I feel like there's always some blended line somewhere that people are confused about.
Well, to answer the first part of the question, this is, we're still dealing with the, American human beings. So it's a lot of the same things, but I feel like it's more so. The lack of sunlight that we have for so long and the low levels of vitamin D, everything seems to just be more exuberant. Every single psoriasis case, every single atopic dermatitis case, they seem to be constantly flaring, especially when in the winter time.
Yeah.
I have to say that I've never diagnosed so much psoriasis, and I think it's because when I was in Texas and Georgia in the military, maybe the mild cases just never made it in, during, 9 months of sunny weather. And they just thought they were getting tiny little rashes. So the
Mhm.
mild cases become moderate cases, and the moderate and severe cases become all severe cases, right? Or perpetually flaring cases. So we see the same things. I just think the patient's perception, their sense of self, what they determine that they have a problem on their own without anyone telling them that they have a problem, yeah, I think that's much, much higher here. Um, I think the flip side is photodermatoses. Anything that you can get while exposed to the sun, right? So we're talking about solar urticaria, polymorphous light eruption, and then You don't see a lot of the other ones, the Jesner's lymphocytic and things like that. But it's bug bites. Those are huge too. When the people in this state get sun exposure, they it's almost like their skin type zero here. I mean, like they just get the worst rashes. They go to Hawaii. Our direct flights are Hawaii, Arizona, Dallas. I mean, just exactly what you'd expect.
All the hot spots, yeah.
All the good places. Vegas. Oh, I forgot Vegas. And so everyone just like takes that direct flight and they're like, I don't know what's wrong with my skin. But then the opposite will happen to some people. They'll have rashes they've had for their whole lives. And they're like, 2 weeks in Hawaii and I'm perfectly fine. Like everything's gone. That's a great diagnostic clue. But you find that you're in this dichotomy where things that you don't see that much, maybe severe, and things that we see constantly all the time may improve with different environmental conditions. And so you have to be mindful of that. You have to do a good job counseling these people on what they could expect because it does present kind of a conundrum when you're digging into people's history. At least it's a conundrum for them. It's they don't fully understand why their skin behaves the way that they do. And I find that we have so many transplants that I hear these words. This has never happened to me. This has never been a problem for me in Kansas. It's never been a problem for me in California. It's like, well, how long you been here? I hate to tell you, you're 6 shades darker than you were when you got here, and everything is going to be much more apparent. Melasma is the same way. So, just a lot of really interesting normal conditions that present a little bit differently. People may not know that they have them. People may have considered other diagnoses, but we're here to help them out.
Yeah, that's really interesting. It seems like a lot of those maybe like would you classify autoimmune disorders to be quite tricky as you're dealing with, severity of weather and conditions. An environment. And I wouldn't say that, being here, um, in Pennsylvania, so to say that, we have the four seasons, but I wouldn't say it's that severe, and you get a little bit of that here. But that's very interesting to hear what your community is dealing with and the severity of some of those conditions. I'm sure that's difficult to, you
And
know.
you touch on lupus, we see lupus, but I got to tell you that even in Georgia and Texas, I
Mm.
diagnosed a lot more cutaneous lupus in the summer, for sure. And our
Really?
summer, yeah, because it's photo aggravated dermatoses, right? But here, I mean, summer is not that long. It's
Yeah.
not. And I mean I just this year I went to a health fair, right? And that's the problem being in dermatology. They're like, hey, come take a look at my rash. And I'm like, well, that is one of the most classic looks for lupus I've ever seen. And so but had I seen the same patient in January after 3 months of snow, I can't say what her presentation would have been.
Yeah, it's interesting, the approach, and that's kind of what I wanted to get into next is that, you're having to take in all these environmental factors, but I'm sure there's other ways that you approach, how you work in your practice differently than other dermatologists perhaps. And I'd love to hear some other ways that you're approaching this very differently, aside from, the autoimmune, items and severity of cases, like what else about your practice and a capstone is different than most.
Well, the most obvious thing to change gears completely, the most obvious thing is the burdens of skin cancer, right? So skin cancer is at a high all over the United States. And part of that is the classic, we didn't know we were supposed to wear sunscreen even 5 years ago.
Yeah, what
Um, who knew, and then people's understanding of cumulative sun damage, right? A lot of people just don't get that. Like they'll still say it all the time. They'll say, I didn't get much sun this year. And it's like, okay, but this was from 30 years ago, 40 years ago. See a lot of TRICARE, a lot of VA. Those people get a lot of sun because they're outside a lot.
Yep.
We have snowbirders, right? We have people that I wish I could, go to Arizona for 6 months out of the year, and they come here 6 months out of the year. And while they're down there, they are just laying out, having their best life. And those people get skin cancers. Guess what? They don't have I mean, they go to burn. They don't go there to get that nice even tan. They go there to burn. They just seem to enjoy that.
Mm.
Um, and so I think that's a burden for us. I mean, I've seen some really interesting things being up here. We've even seen cases where people have intranasal basal cell carcinomas, and can't say I ever saw that in Texas. And I started asking around, and I can't remember. I think it was general surgeon said, "Well, that's because of reflection off the snow." And I said, "Never would have thought of that." Like I.
Dang that snow. You would not think, being
No.
who you are, hey, we're not getting that much sun out here. Why is this such a thing? And I think that's a very common misconception about, dermatology in Alaska is, oh, I don't need a I hardly get any sun. What do I need, to do this for? But yeah, that's a huge reason.
We see a lot of patients, like no mistake, but we probably diagnose 100 skin cancers a month. Yeah,
That's a very large number.
it is not a small number. I mean, it really isn't. It's me and my partner, Dr. DeRizes, and we have a PA, Savannah Zimmerman, and a new PA, Sean Allworth, and we biopsy more cancers every single month without fail. Um, and I think it's because we have two sites because we're in Anchorage and Wasilla.
Yeah.
But I also think it's because there wasn't enough dermatology in the state to handle the increased
Hmm.
burden of skin cancer in the Medicare population, right? So predominantly Medicare population. And so, we do handle things differently. My main practice in Wasilla, it's 45 miles north of Anchorage. And so we used image guided superficial radiation therapy with gentle cure. And that was a big part of our offering for a long time, which, there's a good hospital in the area. Matsu Regional is a great hospital. Providence and Regional are both in um, Anchorage. And so we have good surgeons. We have HEMONC, and we have ENT and head and neck oncology.
Hmm.
And then there's a Mohs surgeon in Anchorage, and then Dr. Drizes is also a Mohs surgeon. But even so, there's been several scholarly articles written about, can you really depend on Mohs to take care of all of these lesions and all of these localities
Hmm.
throughout the nation? And the answer is no. Like, you can just do the math, and you can figure out that general surgery is doing some of these, and ENT and plastics, and there's a lot of different groups doing these cases that maybe that's our fault. Like, maybe we should be better about how we're doing this. And so, you didn't ask, but I also do teledermatology, and I did that for a long time, and so I have 40 state licenses, and so I'm very used to saying, what is your next best option where you live for you right now? Because so much of your job is to take into account the community, right? The
Yeah.
community, the community. And so I have had, and I don't do the telemedicine through my company. I do it through third parties. And so a lot of it is remote areas,
Hmm.
prison systems, hospital systems. And it's been great for me in Alaska because it's like, well, what do I do? And I'm like, you fly to Anchorage and you get that taken care of,
Care of. Yep.
right? And so we have the ability to expedite that care. And the reason we can expedite that care is because we try to offer as much as we can, right? We have two sites, Mohs at both sites, SRT at both sites. That's the image guided radiation therapy. And so you just have to know that it's going to be hard. We have people come in with large tumors sometimes, from Ketchikan or Juneau or Bethel, and we're like, we didn't know this was coming, but guess what? We're doing this today,
Right.
right now.
Yeah,
So
I mean, I imagine. I mean, things are spread out, and I imagine you have quite a few people that fly to you, and maybe also a reason why you do a decent bit of telemed as well. Yeah.
absolutely, and absolutely, and we were. I've done telemedicine for so long in Alaska that, like, I already kind of knew the system, right? I knew where the prisons were, I knew where the hospitals were, I knew where the population centers were. I know what doctors here, what doctors, what are they missing? we're active participants in our community. We support American Cancer Society through their galas and things that they throw and their auctions. But those are just to meet the right people, to know who you need to know to have the best outcomes for patients, right? Because I think that outside of Anchorage, I think that skin cancer was a problem, honestly.
Yeah. I mean, it's just crazy to think about what, you still have a decent sized population, but, you know, for the two locations that you have, the amount that you're diagnosing is very large, and that doesn't, like you said, include the people that haven't quite come in yet or have flown in yet,
Right.
gotten things taken care of. And it's just, a PSA to everyone out there. Maybe this is something that you should be thinking about today. Um, and the misconceptions behind it. And I'm sure like this is not the only one that, people in Alaska don't get skin cancer. I love that you debunked this one, but what are maybe some other ones that you come across in your day to day that you're like, oh man, I wish I could get this. Wish I could get this straight through to people. Like this is a situation. This is not true. This is an old wives' tale, whatever that might be. Even on the cosmetic side of things and medical dermatology, what are you kind of seeing the most aside from skin cancer, maybe not a thing in
Well,
Alaska.
I hate to always change gears on you. So
I love it. What's the
I think
perspective,
that
Blake?
yeah, I think that I think that people do kind of understand the skin cancer game
Yeah,
a little bit. I mean,
yeah,
a lot of the times, gosh, because of COVID, like the teledermatology platforms just boomed, right? They just boomed, and a lot of people, a lot of providers out, even out in small towns, they're like, hey, I know exactly what to do with this right now. Like
yeah.
I can, and I've seen so many people in Alaska, so many like hospital groups and federal groups are like, we're going to do our own teledermatology. I'm like, why would you do that? You can get a third party system that will charge you very little money, and you will use this only when it's necessary. You do not have to recreate this yourself.
Mhm.
And you don't have to ask me to recreate it or ask or go beg an Anchorage dermatologist to do this. Like it's already being done for a very, very low price on a lot of platforms, but those eventually do wind up in our offices, right? And that's like the dream, right? That we can provide some level of medical care for people that live that are not on the road system. I mean, we have people that can only fly to their homes. We have people that have to go to a flag stop and only can take a train to their house, right? So boats, that's another good way. Dog sled, that's the fourth. So I mean, some of these people like having a photo and sending it in is so, so, so important. I've never physically received photos, which is, maybe you could have thought that that would have happened, that someone would have mailed me photos, but no, everything is always online. And so I think we're doing pretty good. I think we're doing pretty good on that. I think people know. I think the access, at least for dermatology and skin cancer, is not bad. What I really like to focus on is as far as what do we do? Derm is not all cosmetics. My
Mhm.
training was heavy in cosmetics, but I don't love it. I don't enjoy it. It's not
Yeah,
what gets me out of bed. And so I think that I think that people always think that, oh, we're just like popping pimples and doing this and treating your acne. And of course we do that, but that's not what keeps me up at night, right? Like it's
yeah,
complex medical dermatology.
yeah. What
It's
so
people that are sick and like you're the only person who may have ever seen this before.
so would you say that's like the one thing that wakes you up in the morning?
Mm.
Yeah, yeah,
Yeah, I mean, we have those patients. Like we have those patients. And so if we can take care of them, if we can take care of them early, if we can do it in a group setting, integrate our care through other really talented doctors in the community, we got four rheumatologists. You know what I mean? Like it's really important to know all their names, maybe know their birthday. So just to get things done.
I think people don't emphasize it enough, but when you have a provider that is really intentional about your care and the resources that they have beyond themselves as well to make sure that you're well taken care of holistically is so important. And when you find that person, it makes such a world of a difference for you and what you have going on in your care. and your life going forward. And I think sometimes we see people as just individuals. They're like, a branch to the tree, but you forget about all the other branches that are there, that can help you. So, um, in terms of, you've mentioned a lot of a whole host of different items in terms of misconceptions to what you're helping people with. Maybe you can give us some great pro tips and maybe for two different sides of the coin. I'd love to hear what you have in mind for, a new patient, client that you're seeing or what's going to help your community. But then also I think from the provider side of it, from the nature of what we do and the people that are watching, lots of providers, different providers that are here. What is something that you are really passionate about in your practice or that helps you every day or things that you think that everyone should be doing, that's been really great for you? Um, yeah, I think old dogs can learn new tricks too. This is great for providers that are new, but also people that have had their business for 20 plus years. I think everyone can learn something from great people like yourself.
Yeah, and I don't think I'm speaking to the majority of board certified dermatologists, but I know, there's a lot of there's mid-levels, there's new grads, there's people who train differently, but never discount the full body skin exam. This full body skin exam will tell you what you need to know 95% of the time.
Mm.
I know clinics are busy. I know that the administration is harder every year, and the pressure to see more patients is always there. And to see the next patient and not get behind, the full body skin exam is the most important tool in our toolbox for sure. I don't mean to sound like the people that trained us that tell us that the physical exam is always better than the test, but in dermatology, it's absolutely true. Everything you don't see can affect the patient in a negative way. I have caught a melanoma on every body part you can imagine. Um, so never, never discount those. They're very important.
That's amazing advice. I think, we all take some things for granted. And that's why I love interviewing all different types of people and backgrounds and, getting their perspectives. Because I think sometimes you hear a sound bite and you're like, oh man, yeah, I should really be doing this. Or that's a really good reminder. And I think this is what this is all about is getting the unique perspectives, hearing where people are coming from, where have they started, where they're going. And that how they're helping. So I really appreciate all of this and all the insight that you've been able to give to us. And just to round things out for today, I would love if you could share with folks how they can reach out, how they can find your practice, all the shout outs, Blake. This is
Yeah, absolutely.
yeah.
So we're with Capstone Dermatology, started in Wasilla, as a piece of Capstone Family Medicine, and they're a large family medicine practice that is really a backbone of the Matsu Valley. And they were instrumental in the COVID testing for the state. And they've butted several different practices, and dermatology was one of them. And so I appreciate them for that. Um, and so we're intimately entwined with them in the location that we're in Wasilla. And then we opened in another area that they lease in Anchorage as well. Um, and so we're pretty easy to find because Capstone has a name out here in Alaska. So.
Well, we're so thankful for your time and your perspective on dermatology and beyond today. Really appreciate it, and we hope to have you on again very soon.
All right, thank you.
Thanks.